My name is Michael Corbin, and welcome to King's Pharmacy. I'm doing that for the video, because I know everyone here has met me. So welcome back. Today we'll talk a little bit about Medicare, Medicare Parts A, B, C, and D, and a few other things. That's Erin Blood. There she is.
Hi,
trying to
Erin.
run away. Erin's my partner here in the store. She's also specializes in compounding. So she compounds veterinary medicine, medicine for adults, children. She can take pretty much...
Real louder.
Yes, I apologize. So Erin is also a pharmacist and my partner here in the store. She compounds medicine, and specializes in compounding medicine. She can make medicine for your pets,
Really?
for your grandchildren, for yourself. If you can't swallow a pill, she can turn most medications into a cream. Okay? Or make anything that you need. Okay, and then I'll be the other guy. I'll be doing the presentation today on Medicare, and I'm a third-generation pharmacist, for anyone who doesn't know that. My grandfather started in 1922, my father in 1957, and I'm continuing the tradition. All right, so today we'll be talking about the Affordable Care Act, or just really to get some terms down. The Affordable Care Act, also known as Obamacare, doesn't affect you. Has nothing to do with people that already have Medicare Part D, or an HMO, or anything where you're already a senior citizen or disabled or already qualified for it. So it doesn't affect you at all, okay? So Medicare Part A, B, C, and D. Does anyone know what Part C is, or has anyone ever heard of Part C?
Yes.
No, I never.
Nobody's ever heard of C? What's
Yes,
C?
I looked it up, actually. It's
Okay.
It's the Medicare affordable, sort of HMO type of thing.
That's exactly what it is. It's an HMO.
Oh.
That's another name for a Medicare HMO.
Oh.
This is a real brief history of Medicare. 1966, Medicare started, and that was just A and B. In 97, they started, Medicare started paying for HMOs. So they called it Part C, for lack of a better term. And they also have PPOs. And then just recently, about 4 or 5 years ago, they started doing Part D. And that's mainly what we're talking about today. That just gives you a little bit of a history, so you know I did my homework.
Oh, I don't have it.
Smart guy, he doesn't understand it either, so it's okay to be confused. All right? I can also tell you what E equals MC squared is, but I won't get into that. So for 2014, there are 30 drug-only plans. A drug-only plan is called a PDP. You'll see it after a long list of numbers and letters that identify a plan. It'll say PDP. That's a drug-only plan, or Medicare Part D. There'll be 29 HMOs or PPOs available in this zip code. Those are Part C. Okay, and you know what they are when you see them. There are 6 HMOs and PPOs that do not offer drug coverage. I don't know why they exist. I guess maybe if I were to be enrolled, that's what I would get, because I own a pharmacy. But other than that, I don't know why they exist, but they do. All right, the way to get the information is you go to medicare.gov, www.medicare.gov. Okay, that's where I got all this information I'm going to give you. I didn't make any of it up. I went there, I did the research, I put it in a format that is, well, I'd say easy to understand, but don't worry, not till the end. And you just follow the series of questions that they have for you. For example, they ask you to put in your zip code, a list of the medications you take, and you're done. All right? Everybody understand? Questions so far?
Oh, when you put in the medication, did you put in the generic or the...
Whatever it is you take, whatever it is you actually take, whatever you want them to pay for. I'm going to get to that right now.
So this is the Part B.
So once you enter the Medicare.gov website, this is what it looks like. right? Start here, and you get all the way over there, and it looks pretty easy, right? I put this there because I know it's confusing. I know it's a lot. It's a lot to take into account when you have to do it every year. It's a big choice, especially when you might not know what medication you'll be on in 3 months. So how do you make a decision based on everything? So we'll get to that. I also put that in there to make it easy or a little sense of humor. Okay, so this is what the Medicare.gov website looks like when you enter Plan Finder. Okay, this is exactly what it says, and it asks you for your zip code. All right, you put your zip code in, it'll let you know what plans are available to you. The next question they're going to ask is, I'm not sure if you can see this.
What are you doing?
Well, let me hit the next one. It asks you for a list of your drugs. This is what it looks like after you type in the word atenolol. You type in atenolol, then it'll ask you what strain. You type in, you just click on the button, 50 milligrams, I take 30 of them every month. That means you take 1 a day. That's what Medicare does. It's as easy as that. And of course you click on the button that says you get it at a retail pharmacy. Right? Why would you do it any other way? Okay. My presentation might be just a little biased towards retail pharmacy. All right, so after you do that, for as many drugs as you take, 20, 30, 50 drugs, doesn't matter. You just put all the medications that you take in there. By the way, we're at King's Pharmacy. I figured I'd put that in there as a cheap promotional plug. Oh, and you can select up to 3 stores.
You're an approved pharmacy.
We are a pharmacy that's enrolled in every single plan. Okay, we're a provider for every single Medicare plan. So when you do go to select a pharmacy, they'll list them all. I'm sure you recognize that name. I think I've said it 4 times so far. That's King's Pharmacy. That's right. You just click on Add a Pharmacy, and you can add up to 3 pharmacies. But after you've done us, you can just move right on. This is the next step, and it's almost the last step. Okay? I know you can't really see it. This is what it says right now. It says, due to the government shutdown, the information on this website may not be up to date.
Right.
Okay? It says it there. It says it there a couple of times before you even get to this spot. They haven't updated it since, I guess, the end of September. So the information that it's still up and running, but it might be a little bit dated about the cost of the drugs or some other functions that they provide. But it is a working website. We'll get to that in just another second.
This is not good.
The next thing it does is it asks you about the plans. Which type of plan would you like? And the prescription drug plans with original Medicare, that's the PDP plan. The Medicare Part D plan. So if what you're interested in is a drug-only plan, you click on that button. If you're interested in an HMO, it's the next one. A Medicare plan, a health plan with drug coverage. And then if you own a pharmacy, you click on the 3rd button where you're only interested in a health care plan with no drug coverage.
What is this? You said the PDP was the first one?
The first one is a PDP or Medicare Part D.
Because the second one almost says the same thing.
It does, but it includes, I'm glad you noticed that.
It says Medicare.
So the
Health-
first one is a prescription drug plan where you keep your original Medicare, that's parts A and B. So you would have your A and B, probably with a supplement, and then you would have D, which would cover only drugs. This is the one that most people do select. You select this one if you have or are interested in an HMO. An HMO would take care of everything. An HMO is basically taking parts A, B, and D, putting them together, and they call it Part C.
You get the same prescription coverage as you do in the first one? Generally.
Yeah, Well, HMOs vary just as widely as Part D plans vary. So there are, I believe it said 30 of them, a lot to choose from. All right? It can get a little confusing. But once you've selected one, I think you can even select two of them, so if you want to select both, you can. Once you've selected it, the next thing it'll bring you to is a list of all the plans. It'll list them all in the lowest estimated annual retail drug cost. In other words, the best plan will show up first. Okay? And I think I only entered a 10 all in this example, so it doesn't really matter. But what really is important is looking at this section of it. This section of it will list, in this case it's showing you that because you selected King's Pharmacy, we're a network pharmacy, the annual cost would be $227. That's taking into account January through December. That's your premium, deductible, and copays, if there are any. Okay, adds everything up. So it takes all the guesswork out of things. You don't really have to worry about is it a high premium or a low copay, or a high copay and a low premium. Doesn't really matter. As far as I'm concerned, a premium, a copay, and a deductible, they're all money. They're all a way for the plan to take money out of your pocket and put it in theirs. So whatever label they want to put on it doesn't matter. It's being taken out of your pocket, and that's what matters to me. The one with the least amount of money is what's important.
How did you get to the figure 227? Let's say you have 5.
They did that. Oh, the computer did that based
Mike,
on.
can you speak up, please?
Yes. The computer, the Medicare.gov website, generated this information simply based on my zip code and a list of drugs that I put in, just for an example. It has nothing to do with, it's going to be different for everyone because we all take different medicine.
Is this only for one drug?
Well, I think for this example I may have put one in, but I don't remember.
You said you put
One.
one.
Yeah,
$27 a year for one
I actually
drug.
worked on this quite a bit, so it doesn't matter, because each time we do it for you and your list of medications, and it shows up the answer specifically for that zip code and that list of medications, so it's very personalized for you.
What annual 227?
Mm-hmm.
Is that the annual payment? In
Everything.
other words,
The whole
it's like
year.
$20 a month for the year.
Everything. Add up your premium. I'll get to this in a little more detail. That's the point. Is it's adding up your premium times 12, right? Your monthly premium times 12. They're assuming that you're going to get the same drug.
$227.
This is just an example.
Just a
I'm
number.
showing you. Once again, don't focus on the number. Don't worry about the number. This is
Plus the
just
41
for
bucks.
example purposes. Okay.
What's the other column where it says
A
$15?
mail order is a separate
In this case,
premium.
that's the premium.
How about the mail order?
Okay.
Well, I'll show you that. If we go back out, each column, estimated annual drug cost, monthly premium, deductibles and drug copays or co-insurance, and it talks about some other things. So in this case, for this plan, $15 a month is the premium, and they're saying that you have an annual deductible of $325.
Ah.
All right, this is once again just an example.
So you have to meet
I'm
that
not-
325.
Exactly. I'm not suggesting this plan for anyone. I'm using it just for illustration purposes. Okay, please, it's not an advertisement for AARP. It's just so that you understand what the numbers mean. We're going to actually get to what they mean a little bit more. And, here where it says, they do also provide you with the information of what you would pay if you got it through mail order. So if that same drug list was purchased via mail order, it would be $2 more than if you had ordered it in a retail store.
Excuse me,
Okay?
do you give a 3-month supply?
Yes.
It's almost.
Okay. So moving on. This is once again discussing how to pick a plan. Okay, I talk about the ones with the lowest premiums, copays, or deductibles. Some people say, I want a plan with no deductible.
That's right, yeah.
I don't want a deductible,
Pay nothing, get everything.
right? But you also want the drugs free,
Well,
and you want the lowest premium.
Right,
right.
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 I don't blame you.
We
Gotta
gotta
be a
have,
congressman.
we gotta have.
Right, become a congressman. What's really important is you add the three together, and you pick the one with the lowest total sum of those three. So if you find a plan that has no deductible, it might have a higher premium, or the drugs might cost a little bit more. They're gonna get some money out of you somehow, but what's important, and don't get mixed up by any one of those columns. Keep in mind it's what those three together add up to that matters. Okay? In case you want to know more about the website, they actually have a section on the right-hand side of their website on lessons, Plan Finder lessons. They actually have videos and tutorials on how to do this. Okay, so if you want more in-depth information, they have five-minute videos, a 5-minute video on each one of these sections on how to do it, a step-by-step video on how to do it. Okay, but we'll get to that even more in just a sec. Okay, so assuming that we've, I guess, understood everything I've said so far, you've now picked a plan based on the information that you have today. In other words, the medication that you're using today, you've picked a plan. I know January 15th, your doctor's going to change your medicine. It's bound to happen, right? Nothing you can do about it. You can't change your plan. What's done is done. You just hope for the best. You hope that it changes to a drug that's on the same tier as the one that he discontinued, and that things don't change too dramatically. Open enrollment period is October 15th through December 7th. That's it. As soon as December 7th hits, it's done. Okay? If you don't pick a plan, or I should say if you don't pick a new plan, you're automatically enrolled in the one that you currently have. Okay? So it is time to take action. And that's it. Time to change, the time is now. Plans change every year. Okay? The plan that you have this year is going to have the same name next year. It's going to have a different premium. It's going to have different deductibles. It's going to have different copays. The only thing that's going to stay the same is the name of the plan. Okay? Your drug regimen may have changed over the year. It's an opportunity for you every single year, not just this year, but every single year, to pick the right plan for you based on your current situation. Okay? What medication you're using now. Okay, so don't ever think that just because you have a good plan this year, that's going to be a good plan next year. There are several plans that exist this year that won't exist next year. They're being discontinued, like SilverScript. And there are several plans that do not exist this year that are being opened up and put into place for next year. Okay, so there'll be new plans.
Are you going to speak about the fact that if you haven't had Plan D before, they tax you for every year that you have not been in the plan?
1%. Okay, if you don't have a plan and you were eligible and you did not have insurance, okay, if you have insurance, you're exempt from it. But if you did not have insurance, if you opted to go it on your own and you decide to join now, the government tax on a 1% premium for every year you were not enrolled. So if it was 5 years, it's 5%.
Well, suppose you don't take any medications, then you don't need a drug plan.
You still
That-
need doctors.
It's a great comment. Now, granted, your doctors are covered by A and B in your supplemental. If you don't take any medicine, you can continue to roll the dice. Do you have car insurance? Right? You have car insurance, you hope you don't use it, right? You don't want to get into an accident. I know I filled a prescription this morning for somebody. It was $2,800 for a 15-day supply of medicine.
Oh, you gotta get.
Okay, it was $2,800. Okay, I promise you, you cannot predict the future, and these plans are simply being offered to you as a way of capping how much you could spend on medication. protecting you. It's insurance.
And what do you do if you can't? Is there
You
a,
can't have a question.
If you
Is there
can't,
No.
if you can't afford the premium, there's,
you can't afford the drug, is there a option to appeal to?
yes,
Excuse
with
me?
every plan.
Can you repeat the questions for them?
We
Yes.
Because they
have a
can't
question.
hear.
Great idea.
Thank you.
Thank you.
I'll get to that, okay?
Just out of curiosity, what year did Plan D, go into effect?
This is it was 2003, the law was passed, and it went into effect in 2007? Six or seven.
So that would mean if you haven't had a plan today, you're being taxed 6% extra.
Exactly.
Got it.
If you did not have any other insurance, so if you had insurance through your pension fund, or if you had insurance on your own, those years don't count, that you were exempt, you didn't have to have it, so there's no penalty for that.
And you have
Or
about,
even through the VA counts.
and you have about, once you terminate that one, you have about a month to 6 weeks to enroll. You have a period.
There is a grace period, yes, there's a grace period. Okay?
It's 2 months. I just
So
read
if
all
you
that.
have a plan and you disenroll in it, there is a grace period before you have to join Medicare without suffering a penalty. If you don't want a plan, nobody's forcing you to get a drug plan. The government, this isn't part of the Affordable Care Act where you'll have a penalty on your taxes if you don't join, because you have Parts A and B. You have health insurance. This is just drug insurance. Okay, so the penalty is 1% added onto your premium. Okay, not 1% added onto the cost of your medicine. 1% added onto your premium.
Onto the premium, okay, so
Okay,
these
just your premium.
6% from the
Right.
added on, got it.
So 6% of the $15 or 6% of whatever it is you do.
Wait, it's only the premium?
Only the
It's
premium.
not the cost, which includes the deductible?
To the best of my knowledge, the deductible stays the same. It's just the premium. Okay? Right ahead.
I'm on a self-injecting drug, Forteo. It costs a fortune with Medicare, A and B, and prescription D.
Yeah.
And,
You just add it onto the list and it'll
and
find
it's a
the
2-year
plan.
commitment. No, I'm just saying, are they ever going to bring that price down? Are they ever going to get a generic for it?
Yes. The question is, you're right, the question is a brand name drug, will it ever go generic? And the answer is 17 years after it was patented, it goes generic.
Well, I'll be broke in 2
We
years.
did.
Well, usually a drug is patented, and then they continue their investigational studies for about 10 years before it's even brought to
Then they take
market.
it off the market.
So once it's brought to market, it's usually about 7 years before the patent expires. Okay? And of course, the drug manufacturer wants to not only make its money back, but a little bit of a profit.
And really, they're paying only a few dollars more than I am every 28 days, because it's only a 28-day supply.
Yes. Yes, but once you hit your catastrophic, and we'll get to that, the price goes down dramatically.
You gotta get to the donut hole first.
I tell you what, hold your questions for just a minute, because I have a lot more information to give that may answer a lot of the questions. So once again, the plans change every year. My suggestion is that you do the research to find out if there's a better plan for you every single year. Okay, here we go, the good news. We can do it for you. You don't have to go home and do this Medicare.gov using a website that hasn't been updated or might be very slow. Once it is updated and re-updated, it's going to get very slow. And it can be a little bit cumbersome answering all the questions and figuring it all out. We actually have a computer program here that works a lot faster. It accesses the information from Medicare.gov, but it moves very quickly. And it answers all the questions, and it shows you all the information. It'll tell you exactly what your medications will cost. It'll tell you exactly what your premiums are, your deductibles, your co-pays. It helps you, in the same way, find the right plan for you based on your specific list of medications. Takes about 2, maybe 3 minutes to to put the information in and you have the answer. Once we have the answer, we can then show it to you, email it to you, print it out, or you can enroll right there. It's going to be on one of our iPads. You can just hit the enroll button and be enrolled in the plan, and you're done. You can wait 12 months and do it again the next year. Okay, so it's free and it's really easy to do. Now's the part where we ask questions. Okay.
The prescription insurance that we have, and we each have a different company.
Yes.
Okay, that's how it was set up. Now, within each prescription plan, there are preferred pharmacies. Okay,
Yeah.
now,
I didn't wear
for
mine.
instance,
I'm not wearing it.
Target, Walmart,
She's not gonna
whatever.
wear something.
Let me
Yeah,
just,
Kings.
right, I'm going to repeat the question. The question is about preferred pharmacies. Each plan has a list of what the preferred pharmacies are,
It's not fair.
and it's not. He said it's not fair. I'm agreeing. This year coming up, there are more plans that have preferred pharmacies. Okay? There are, I believe, 4 plans left out of all of them that did not restrict you to a preferred pharmacy. Some of them are Walgreens, some of them are CVS, some are Walgreens Target CVS. Walgreens and CVS aren't the same, ever on the same plan. But all the plans have done, almost all the plans have done that this year. And independent pharmacies have been excluded from all but 4 of them. Okay?
Would you be on any plan that is a preferred pharmacist?
There is. There are a few where we're listed as a preferred.
Right.
But more importantly, picking the right plan for you doesn't necessarily mean that that we'll be listed as the preferred pharmacy. Where your copay might be $2 at Target and $4 here, we're actually working on a program to try and make that easy, a little bit gentle for you. And I will be announcing it right now. I was thinking we would wait to try and, once we got all the kinks worked out, but we're working on offering free goods to offset the cost of the difference in copays. We haven't gotten all the kinks worked out of it yet, but we're trying to, we're being understanding in that, you know, if you do choose to use us and are willing to pay that extra few dollars, that we're going to try and help offset some of it. Okay.
Beat the lowest
But,
price.
but providing better service and at the same time offering some free goods to make up for the price difference.
What do you call free goods?
Yeah.
Goods that don't cost anything. That we're working out the kinks and exactly what it will be, but it's merchandise from the store that, not things that you're gonna throw away.
In other words,
Yeah.
your co-pay could be entirely different than Walgreens or Target or
They're
whatever.
right. Well, an example would be AARP for this year.
And let me
This-
ask you, what about the tiers?
The tiers are going to exist no matter what. No matter where you go, there are usually 3 or 4 tiers, and depending on the drug that the doctor prescribes for you, that's where your tier will fall in. And that's actually where choosing the plans comes into play. When you run it through the computer system, Tier 1 drugs are the lower cost preferred drugs. Tier 2 are the next higher cost, and Tier 3 is the next higher cost. And if there's a Tier 4, they're even more expensive.
Is your tier gonna be the same as?
No, everyone's tiers are the same. The tiers are carved in stone by each plan, and that doesn't vary. So if a drug is in Tier 1 here, it's in Tier 1 there.
And you could
No matter.
charge $5 for a copay and they can maybe charge $3. Is that what
Right,
you're saying?
that's exactly what the
What?
preferred, that the copay, a preferred pharmacy will have a lower copay. Okay?
why
Some
don't you,
people keep
Well,
their
maybe
seat.
you'll be
why don't
on the
you
plan that we.
offer a competitive price, and if you're the low bidder, you're gonna get the business.
Should have my microphone.
The deals that were done, quite honestly, the deals that were done to decide who was a preferred pharmacy and who was not, we weren't invited to the table. We weren't invited to sit down and place an offer.
That's
But you
exactly
know the
right.
price.
I don't shouldn't have
Actually,
been
our government has already said it's illegal.
When you're ready.
Because Medicare has an any willing provider law, so any willing provider should be able to offer it at the same price. And our senators and congressmen have said,
I forgot
we
my
know it exists, but we're not
supplementary.
gonna do anything about it because things are just fine.
Yeah, they're trying to be honest.
They wanna be reelected, so they're not going to go against who's donating the most money to them. CVS, Caremark, Walgreens, Target, Walmart, they're donating a lot of money to our senators and congressmen, a lot more than I can. So they're not going to do anything about it. I just have to face that fact.
But you are on the medical plan.
I'll explain that in a second.
I price a drug here, which I get from Canada, okay? And I was amazed at the difference in price. Now, if I have a plan and I buy that same drug,
I think I'm
is the
over
quote the price for that plan
I will.
the list price for the drug, or is it the tier price for the drug? Can you explain that pricing?
Absolutely. So if a drug costs $300, okay, as far as the retail cost goes, and your plan covers it, it might come out to be a tier 3 drug with a $45 copay. Okay, it means that your price is $45.
So in other words, you quote the price of a drug, $250, and then my copay, because I have insurance, could be $40. So
Right.
it would not cost me the list price of the drug.
Right.
If the non-plan price, it would cost me the copay, $40.
Right.
I got it.
In other words, if a drug is covered by your insurance, you pay the copay,
Uh-huh.
okay?
Pay the rest,
And then the insurance company pays the rest, or they pay what they want to pay. But it doesn't affect your cost, because your copay is set.
I haven't found Canada to be cheaper.
Okay. It's a whole nother discussion about it.
Been there, done that.
Let's see. This is it. I did this to show just how confusing it can be. It's a big jumble of things that I think, this is a personal opinion, I think Medicare has designed it this way through the insurance companies to be confusing.
I think so. Why?
So that you just stay with what you have. I personally think that that's what they do. It's too confusing, I'll stay with what I have.
Us four people here have AARP, PPO, United Healthcare. Are you still taking prescriptions from that company? So if we decided to stay with it, we
Yes.
can?
We are enrolled in and accept every single plan. All of them. Some of them were preferred, some of them were not. As we do the research for you and show you what your annual cost is going to be and which plan is the right one for you for next year, you'll see if we're a preferred provider, and it'll tell you exactly what your copay will be here. Okay?
It tells you in the book,
Right, but the
not
pro-
every drug, but it
right.
tells you generics last year was $6, it'll be $8.
Right, and
And it
and
compares
the
different other
the
companies.
book. She's mentioning the specifically the book for
Medicare.
AARP, or
No, this is
oh,
the
this is just the Medicare.
It has different plans, and it gives you an idea of what the generic is gonna be for the different ones, for the
Okay, it
HMO,
shows
the PPO.
your overall stuff, but it won't list which one you should join. It just gives information about the plans in general. Okay, which can add to the confusion, because you can study all this information and still not know which is the right plan for you, which is why the program that we're using can very quickly, 2-3 minutes, tell you which is the right plan for you. You can look at it very deeply. You can look at each drug It can even tell you that if you're on a certain medication, are there alternatives to that medication that would help lower the cost of your overall co-pays or premiums, or help you select a plan.
I've heard the term donut hole.
Mm-hmm.
Is that applicable to this situation?
The donut hole for this year coming up is, I thought
Went from 27.90 to 28.90.
2850.
Went up about $100. I went into the
Close the gap.
I went into
So I'm worried that means you bought more than 28.
$500 a month just for paying that.
So for next year, you go in the donut at $29.70.
Oh, that's even better.
Okay, this year it's $28.50.
27.
2070. So this year you go in the donut at $29.70 and you come out at $4,700.
That means you have to pay the difference between the 29 and the 47 out of pocket.
Okay, let's talk about the donut. You go in the donut when your total drug costs reach the amount you go in the donut for. And that's what you pay and what your insurance company pays added together. That's how you go in the donut. So if you find a plan that offers you a drug for free, but they pay $100, $100 went towards your donut. Okay? $29.70 for 2014. Okay, so you go in when both you and the plan together have spent $29.70. You come out of the donut when you personally have spent $4,700. So take out what the plan paid, doesn't matter. It's when you have an out-of-pocket expense, $29.70, and when you have an out-of-pocket expense of $4,700, you come out of the donut.
That's just the drugs.
For drugs. Okay? And then you're in the catastrophic phase, where you pay 2.5% for your generic drugs, 6.5% for your brand name drugs.
If they're covered by Medicare. If they're not
Well,
covered,
it-
it's okay.
They're covered by your plan.
Well, you wouldn't be on the drug all year long. We're still talking about drugs that you've been on all year long.
Right.
So that's, nothing's changed. If you're on a drug that's not covered, plain old not covered, it doesn't count.
I know,
It doesn't go towards anything.
I know. You pay whooping prices for it.
You pay a lot of money.
So in other words, you're in the hospital, you have a catastrophic illness, you are, drugs for this illness suddenly skyrocket up. And so what you and the insurance company pays goes above 2,800, you're in the donut hole. Above 4,700, you're catastrophic. So you're paying, even if it's a one-time illness, you're filling up the donut hole out of your pocket.
For medication you get in the hospital,
Yeah.
I don't believe that counts. That's covered by parts A and B.
Yeah.
Okay? Okay, it's part, we're talking about D, so it's drugs that you get on an outpatient basis.
Okay.
What about VA drugs?
They don't count. If you get a medication filled at the VA, okay, the question is if I get something filled at the VA, does it count? It does not.
Oh,
She has a question.
Am I
Yes.
recognized?
Yes.
Oh, thank you. I know that I don't even expect you to determine which plan is best for each one of us. But my question to you, because you see so many people that come in here, is there one plan that stands out above all the rest?
Okay, so the question is there one plan that stands out above all the rest? And she does not expect me to select a plan for each and every one of you individually. And I'm here to tell you, actually I'm going to help you select a plan individually for you that's best for you personally. Might not be best for your next door neighbor or your best friend, but it's best for you based on the medications that you take.
Good.
Okay?
The answer to the question.
The computer program that we use is a non-biased opinion.
That's right.
It is not going to be influenced by me personally, or by anyone personally, or even by you personally. It's just going to give you the facts based on your zip code and the list of medications that you use.
When do we get that?
What I'd like to do is wait until the government shutdown is over, so that they update all the information, so that the answer, because it's working right now, but I want to give you the most accurate information possible.
Absolutely.
And since the open enrollment period is October 15th through December 7th, if we could wait about 2 weeks before we start doing it,
Okay.
you'll get the most accurate information.
That's
Thank
wonderful.
you. I
Okay?
appreciate that.
All
But
right?
if the government shutdown lasts a lot longer than
We wait.
We're all kind of screwed then, aren't we?
Oh, what?
We're all kind of screwed,
Absolutely.
because then a lot of bad things happen, and this becomes very minor compared to it.
Yeah, but
The
the
info-
dates then might
Yeah.
have to be changed.
The
or
information,
change
yeah, the information
the
that's
program.
in their site right now is accurate based on September 30th. Okay? So if you'd like, we can still help you based on that information. Okay? I know there were 2 plans as of that date that had not provided all the information to the government to have their plans show up in any of the results, even though they exist as plans.
Who's that?
I can give you their name in just a sec.
So we can.
But if we wait, really, I'm sure by the 23rd, they'll have this fixed, because they don't want to default on some big debts, right? Make our bonds go.
Michael, when I was in, I gave Sal a list of all of my medications. I just gave you my email. Can I expect an answer via email? Is that
If
how
you-
you're going to do it?
If you'd like it. What we are going to be doing is calling you. Once the site has
Oh,
been reactivated and up to date, we'll be calling and saying it's ready. We have the list of everyone that's given us their information. We'll prepare it before you get here, so that when you get here, it's just 1 or 2 minutes showing you all the plans, comparing them side by side, letting you see what each and every single one of your drugs would cost if you joined Plan A, B, or C, what your premiums are, deductibles, letting you see all the information.
Don't we
Okay.
have to give you the list of our drugs?
Well, we have
Yeah,
a
no,
list,
No, but I
Yeah.
have,
and very quickly we can add or take away anything that's on that list, so that the information we show you is accurate. Very, very quickly.
next question, which is
And-
personal. I'm gonna get 6% added to mine because I've never had a drug plan. I have to do the arithmetic on that.
Actually, we can add that in if you'd like.
Okay, let's go.
There is a place where we can add that in. Her question was, because she hasn't joined a plan yet, and she is going to suffer the 6% penalty by choosing a plan now, will that affect the information, and will it show up? And the answer is yes. We can have it worked into the numbers, so the numbers are accurate. Okay? Yes.
My friend Joni doesn't come to this pharmacy. So when you call her, you'll get from her list of drugs that she takes?
Yes.
Or do you want them now?
No, we can do it, or you don't even need an appointment for this. You can just walk in, we'll do it for you for free, right there while you're waiting. And you can walk out, we can then take that information and email it to you, so you can look at it in even more depth. Or you can just sign up right on the spot. There's a button that says enroll. Okay? So we've really made it very, very easy for you to pick the best plan for you. Okay? Yes?
Yes, what if you use this pharmacy exclusively, like I do, and you come in with a new prescription and you're on a lot of medication? Do you automatically check the interaction with that new medication with all the others?
Yes.
Because once, with prednisone, I got stuck with a Percocet drug, a very strong drug, which did not work at all with, as it happens, prednisone. It does not work with prednisone, it only works with Tylenol. And I took that drug for a considerable time and it wasn't helping me. So it's a very important thing for you to do.
Yes.
But I
We
was
do.
wondering, do
We-
you have to request it
No,
as a
we,
patient or not?
we check, for, just as a point of pharmacy, we check for clinical drug interactions
You did.
going back,
Stop.
6 months for any drug that you've received. The pharmacist reviews them and tries to determine if the new drug being prescribed for you is appropriate, is, if there's a drug interaction, and if it's something that we feel is safe for you to use.
You did that with me.
Yeah, there are 5 levels of drug interactions. Category 1 drug interactions, very serious. 2 is less serious, something where added drowsiness, and then 3 through 5 being usually very a book interaction, usually not something that'll happen to a person. We look at all of them. We look at every single one of them. We try and determine when do we need to call the doctor, when do we need to discuss it with the patient, and then we are available for every single prescription to discuss your medications. Okay? By the way, mail order's not. Has anybody ever gotten anything mail order? Don't answer.
Mail order?
But you wait a little while to talk to a pharmacist.
No.
Yes, you have to go through a whole,
Go through, tell a story to a dozen different people, and then wait a half hour to speak to somebody.
almost.
It doesn't happen here. All right? If you call and you have a question for the pharmacist, you do get on. So I know that it costs you a little bit more to shop at a retail store or to shop at King's Pharmacy as opposed to Target. We try and make it worth your while.
Try to keep you in business, because the big companies don't care whether you live or die. You do.
They just want your money. All right? We wanna do the best we can for you. That's why this program that we're doing is offered to you for free. And we may not show up. The plan we suggest for you may not be one where it's best for you to shop here. That's okay. We'll get you back in 2015. It's okay. We're gonna do it because it's the right thing to do for our neighbors. All right?
That's what happened,
That's very nice. He's a neighborhood drugstore.
It's wonderful.
Thank you. I'll stick around if you have any more questions. Thank you for coming.